Hi and welcome to the Dare to Be Healthy show. This is your host Alia Almoayed, broadcasting from the tiny little island of Bahrain in the Middle East. I'm very excited today because I have a very special guest. I'm with Beatrice Zukowska, and she will be talking to us today about a very interesting testing method for breast cancer and for some other cancers called thermography. And thermography is preferred to mammography in general because of various reasons which we'll discuss now. And I have so many questions. So Bea, thank you so much for coming on the show today.
You're welcome. Thank you for having me in the show.
Well, Bea, I wanted to start by, because I mean, I've heard about this thermography from the internet before, and there's always this comparison when you read about it on the internet. There's always this comparison between thermography and mammography. And people are always saying that mammography is dangerous and thermography is more effective and it's safer. So let's start with the comparison because that's what's on everybody's mind. And let's just jump right into discussing how do they differ and how do they compare?
Okay. So they are different because they are different technology, okay? So maybe I will start the mammography. Everybody knows what is mammography. Everybody knows because it's used for many years. But I would like to start with thermography. Nobody know in United States start to be very popular, but I will tell you about how the thermography works. So technology is that is capturing naturally produced heat from the surface of the body and create a picture to help detect sign of injury or disease. So how does it work? When the body functions normally, a distinct pattern of temperature is created and temperature differences between sides of the body is within normal range. But when body functions abnormally, this pattern and side-to-side measurement might change and become detectable with thermography. So what that means? That means we talk of course about cancer and precancerous tissue growth. So we know that when cancer and precancerous tissue grow is always growing faster than normal breast tissue. And the faster the growth rate, the greater amount of heat is produced. So as the technology is create picture from naturally produced heat, we can see inflammation, we can see precancerous tissue growing because we can detect that with this technology. Mammogram is slightly different, is looking for the mass, is anatomical technology. So when cancer is already developed and is having 1 centimeter in size, for example, then can be detected by mammography. So that's the difference. And of course, the cancer is reaching 1 centimeter in size, growing to 1 centimeter in size. This can take 7 to 10 years for tumor to grow to this size. And before that cannot be detected by mammography. So that's the difference. So we can in thermography we can say that thermography signal the risk of developing cancer, and mammography, MRI, other method detect cancer. And the biopsy, of course, confirm cancer. We can say that thermography is detecting cancer. No, is the risk is a tool that is just showing the risk of developing cancer or any other inflammatory problem in the breast.
Well, let me ask you this. I was reading about thermography at some point, and I saw somewhere that it said that thermography can pick up a cancer much earlier than mammography, even up to 10 years earlier, or sooner,
yes,
at least, than mammography. Is that because it's anatomical And it's the difference between anatomical and physiological. I don't understand this completely.
Yes. The mammography is looking for a mass that is already calcified in your breast.
So it's an established cancer. That's what mammography will pick up.
Yes, exactly. And they complement each other. They complement each other because the thermography is just showing you sign that something is developing in the breast. Okay. But mammography is showing exact location of the tumor.
But then if we're saying that mammography is dangerous, and it's been researched that there are dangers of mammograms, and that they could be even up to 1,000 times more dangerous than an X-ray, for example. Could we actually replace the mammography with thermography, or should they go together?
No, we can't replace mammography for thermography. They should go together. As I said before, this is just risk assessment tool, and is showing you in the beginning of the process what's going on in the breast, but cannot be replaced with the mammography. That was the problem in the beginning of in the start of thermography, that they were looking for replacement for mammography in 17 and 80s, and there was huge research done with thermography, and unfortunately thermography was dismissed because of cannot replace mammography. Absolutely not. No, they go together, and they are like there are two different technologies, so they cannot one is following the other.
So could we, because it is usually recommended that after the age of 40 women should do mammograms regularly, and yet there are all these side effects. So could we maybe do more thermographic tests, and then do the mammogram only when needed, or?
Yes, that's what it is. I believe that when we are getting now, of course, statistically, 1 in 6 women are going to get breast cancer in her lifetime. So it's very, very important that the women get in the age of 20 already exams. I don't say every year, every 3 years, to see the baseline of the breast and if there is any problem. At the age of 30 that we start our changes, hormonal changes, I think that we should start to have exams should be performed every year. And of course for higher risk women as often as necessary. So that's a recommendation for thermography. Today women are encouraged to get the mammogram so they can find their breast cancer as early as possible. But with thermography as your regular screening tool, it is likely that you would have the opportunity to make adjustment to your diet, beliefs and lifestyle, to transform your cells before they become cancerous. That's the main. I believe that this is the best thing about thermography, that you can prevent the cells of transforming to cancerous.
So it gives you an earlier warning, kind of earlier.
Yes, very early warning, and you can do something about that.
Okay. Now, I forgot to mention at the beginning of the show that you're in Spain, and that technology is really fantastic, and it's allowing us to bring all this great information to people in different parts. I mean, I'm in Bahrain, you're in Spain, but you are Spanish, correct?
No, I'm not Spanish, no.
Okay, where are you? You're living in Spain, but where are you?
I'm not Spanish. My mother was Russian, my father was Polish, and I am Belgian citizen living in Spain.
Okay, hence the name. So you just added a lot of more interesting facts to that information. So living in Spain, that was where my question was leading. How do you feel is people's knowledge and education in general about something like this? I mean, in this part of the world, or in this region at least, most people don't know about thermography, and it's very rare that you would find it available for women here or for people in general. But what is it like in Spain, or to any place that you've lived or you've worked as a nutritionist?
Okay, so in Spain it's exactly the same as in your region. Nobody knows about this thermology, nobody knows about thermography, and I am pioneering this exciting technology here. And it's going to take time because it's something new for people, and I think that yes, I need to work harder, and I need to make that available for my to make that available more in Spain overall. I'm just in one part of the Spain, but I would like that this technology is really available to all Spanish women.
And how new is it? How does it compare in terms of time? I mean, has it had enough? Because I know this is the question that people will ask. Has it been in the market long enough to give you real, reliable results? How long has it been available for people?
The research, this technology is available around 30 years. There has been done a lot of study, and this has established really good in United States. But because of the previous research about replacing, there has been 30 years of clinical use in thermology in the US, and about like 8,000 peer-reviewed study in medical literature have been established, and that thermography is a safe and effective means to examine the human body. So, but as I said before, there was in 70s and 80s when this was so well researched. They were looking what is going to have better result, thermography or mammography, and then mammography, of course, is showing better the mass of the cancer than thermography. So that's why it was, but now of course, since this, that's why it was initially was dismissed. But now, of course, currently the doctors are taking second look at the technology as an additional test to be used alongside with breast screening to help improve detection rates, because with the thermography, there also was some study done that with thermography the detection rates are improving and until 90%. So I believe that is very, very important to know that is very, very good tool.
So which one should you do first?
I beg your pardon?
Which one should you do first? Should you do first?
First you should do, of course, thermography to assess the risk of something developing in your breast, and then you can go with other methods that are going to detect what is going on.
So only if the thermography results come back saying that you have a risk, or that there is heat or whatever it is that it picks up, then you should go on and do further tests. Is that correct?
Yes, that's correct. Yes.
And are there any we keep talking about the side effects of mammograms, but are there any side effects to the thermography itself?
No, there are not really side effects. Thermography is like taking pictures, so there is very safe. There's no contact with the skin. I personally have experience with mammogram. That's why I started to research thermography. I had mammogram done 10 years ago, and something happened to the machine and shut down on my breast. for a few more minutes than used to for procedure. So I got, I felt really bad, and I promised myself that I will never repeat that because I was terrified. So since then I started to look for thermography, for something that can replace, that is painless, that is safe, that is not causing any discomfort. And for me, when I find thermography, this was really something very special.
So you're no longer doing the mammograms then?
No, I don't.
By choice?
No, I'm just, I'm just terrified. I'm afraid. I'm not doing. No, okay. No.
And how do they compare in price? If you were to get that, I mean, is it covered by insurance? Does it?
No, thermography for the moment is not covered by insurance. Some insurances, for example, I talk here to, to insurance in Spain, and they can be covered as a preventive tool. There is not as a diagnostic tool. There is still research that they are doing, and but I believe that the preventive tool already is something so important, because it's just more important to prevent than cure.
Yeah, of course. And if you, I mean, would you say that because of the safety of the thermography, can women do it at an earlier age because of that?
Yeah, of course. They can do when they're 20. They can start to do that when they're 20, and they don't need to repeat that every year if there is no any significant problem. And of course, from the age of 30, they should start to do every year.
And you said it detects other cancers as well, not just breast cancer, correct? So men can do it.
Detects skin cancer, detect risk of skin cancer development, and of course there is also other things that is detecting, like some injury that is present in the body, help determine the cause of pain in the body, sport injury, visualizing this, spinal nerve function to extremities, occult dental infection, thyroid condition. So it's not only breast.
And have there been any studies done on the accuracy of that? Let's say you've done the thermography test and you come back with a risk of 80%. So I don't know, people might panic, or some people might panic with 80%. Some people might say, oh, it's very low. What are the accuracy rates of people having gone on to? I know you have a few numbers there. If you can just give us, because I know this is a question on people's mind. Like, let's say I do the thermography test, and it tells me I have a risk of X%. If I don't do anything about it, does it actually happen?
No, the diagnosis of thermography is not done in this way. So it's not. We are doing that with the grade, grade 1, everything is okay. The normal tissue, grade 2, some changes, grade 3, some suspicion cells activity, grade 4 is abnormal cells activity. So there is no any percentage involved in this procedure.
Okay, and take us through the process. For example, let's say somebody comes to you and wants to do the thermography test. How does it work? How long does it take? Would you actually recommend that people don't, based on your analysis of them? Let's say somebody comes in and they're very healthy and they've done everything right. Would you say you don't need to do it, or would you say do it anyway? How long would it take, the process?
I will always recommend. I will always recommend this procedure, because I believe it's very important, and we can be very healthy, and because a lot of people believe I eat healthy and I am very healthy, but we forget about a lot of stress, environmental stress. We forget about our everyday stress, and it's not always that we are healthy because we eat healthy, because it's not what you eat, it's what you assimilate, and we know about that. And some people are so stressed sometimes that they can eat the best food in the world, but they're not going to assimilate this food, and they are not so much healthy inside, because stress is creating acidic environment in your body, and then the cancer is developing in the acidic terrain. The cancer is developing quicker. So that's why I recommend that to all the women to take charge of their health and check with thermography. Because just for peace of mind, just knowing that if this is really something is starting to develop, you can always reverse. You can always do something, and just for peace of mind, I will start to do that very early, and just go back and be sure that you can save. You can save people save women from a lot of pain that they can go through later on. So procedure is not very long, it's just 15 minutes. Of course, women are coming earlier to the office because they are doing health history with me, and then they need to disrupt, of course, and then get used to the temperature in the room. And the procedure is like taking 6-8 pictures, just not longer than 15 minutes with the acclimatization time, so it's very short.
Well, I noticed you keep you several times mentioned women and how they should be testing, but I know that breast cancer is actually very prevalent in men as well, and men get it maybe well, at least from what I was reading when I was researching, that by the time they detect it, it's usually very advanced because they don't have the doctor telling them that they should continuously be testing. But men also do get breast cancer. Do you have any men that come to you at all for that?
No.
I didn't think so, because men do get breast cancer.
Yeah, it's only 1% actually. From my research I have done, it's only 1% of men that is getting this problem. But I haven't seen. I talked to the men, and of course I haven't seen any reaction. No, this is not. No, this is only women. They don't. I know that there are problems with men as well, but they don't check.
And would you recommend that people do it in general? Because if it detects any cancer, or if it detects any problem in general, then whether you're a woman or a man, or at any age, you should be doing it, right?
Yes, I believe so. Yes, of course.
Okay, well, the dreaded question, which I know is going to come up. If this is such a great technology, and if it's such low risk and so many benefits and early detection and all of that, do the doctors know about it?
Yes, the doctor knows
it?
The doctors knows about it. Some doctors, there are all kinds of doctors. It's like everything new. Some doctors are very cautious and they are careful, and they recommend what they know, but there is a lot of doctors that are taking in consideration this tool as a risk assessment tool, and they are putting that in Spain they don't know much about that, so you need to educate them about what is this doing and how can be used. But now more and more the doctors are getting familiar with this technology, and they are learning where it fits in the process of detecting breast cancer. So that's very important, and many holistic doctors are using this technology to assess future risk for cancer. I have a book here that I would like to recommend to all the women. It's probably the only book on the market that is about breast health. It's not about breast cancer. And this book is written by Dr. Ben Johnson, that was also featured in the Secret movie. So the book name is The Secret of Health.
Can we see, can you put it higher up? I can't see it. Yeah, The Secret of Health, Breast Wisdom. And the author, can you put a bit higher, slightly higher up? Okay, Ben Johnson. Okay, okay. So tell us about this book. Why do you like it?
Why do I like this book? I like this book because it's very, very well explained everything what we need to do to prevent breast cancer. To prevent, to you know how we should breathe, what kind of cosmetic we should use, why we should exercise, why we should eat healthy. So that's and it's explaining. We know we have breast, we don't know much, we don't have much education about our breast, and everything in this small book. Everything is there, so everything is explained in details, what to do, how to do, and that's what I believe that is really fantastic tool. This is the first tool for women to educate themselves, because I believe in education. So I believe that first you educate yourself about what should you do, and after you look for the other measure to see how is your health doing. So the Ben Johnson is a doctor that is believing in thermography, and is one of the holistic doctors that is using this technology to assess future risk of cancer.
Well, I can't help but think, have you ever worked with the Think Pink people? Because I know that I mean, every year, at least in Bahrain and around the world as well, there's a huge campaign that is sponsored by Think Pink or speared by Think Pink. And every time I investigate further, I keep hearing that, yes, Think Pink and prevention. And then I say, okay, what are you doing to help people, to give them more awareness about prevention? And I hear mammograms. That's the, that's all I hear. It is all I know. So,
exactly. Yeah, exactly.
So have you? Do they know about something like this? I mean, it's not. A mammogram is early detection. It's not really prevention. It's early detection, and I think it's very important to name things as they are. If you will have your cancer detected early, that's great. But there's so much that you can do before you get cancer to prevent it. Thermography would be one of them, but of course there's a whole other conversation about diet and toxins and environmental stress. And
yeah, but that's a very important part, of course, because that's prevention. That's prevention. Prevention is what we are eating. This is first thing, and that's why this is adjunct to my other business that I'm in. So the first thing for me is the importance of reducing bad processed food in your diet, because this is not assimilating in our body, and that's what creates bad cells. That's what creates the problem. So that's why that prevention is starting from what you put to your mouth. Prevention is starting what air do you breathe, what lifestyle do you have. So there where prevention is starting, because I believe that that's one of the most important things to consider.
I think, yeah, definitely.
Mammography is not helping in early detection, because as we talked before, the cancer needs to be developed in until size of 1 centimeter to be detected by mammography. So this development takes 7 to 10 years, and after, when this cancer is already 1 centimeter, it's developing every year 1 centimeter more. So when the mammography is starting to detect the cancer, is already big. So it's sometimes it's too late to do prevention.
Yeah, yeah. I think definitely awareness is definitely lacking, and I personally, this is me personally, I wish that all the big campaigns out there would mention these things that are options for people, and people don't have to take them, you know, but at least throw it out there, say it, this is part of the prevention. Having a lot of hormones in your diet will also cause hormone-related things like breast cancer. But I wish people would just say it, you know, not many people know about it, first of all, and not many people are willing to talk about it, second. But I know that, I mean, we talked about this earlier as well a bit. A lot of women, at least, when you say that we have this new tool and it's an early detection and everything, they almost don't want to know. They almost have this, you know, I would rather not know. I'm happy in my life. I don't want to test and find something, and I would rather just go on blindly. Have you come across that at all?
Yes, I come across that a lot, and I understand people have a lot of fears. They don't want to know because they are afraid. Just cancer is a big name, is a dreadful disease, and unfortunately we don't have this awareness that we can reverse cancer in the early stage by changing our lifestyle. And that's what I am always telling the women, that we have the thermography for me is like a second line of defense, and I really encourage women to take control of their own health, because and not wait till the lamp approach, that I will have something, I will check, or they will find something later. I don't care now. I think it's very important to have peace of mind, and and breast cancer start to be epidemic. So that's why I encourage women. I'm telling them that this is very important to take control of their lives and check the breast before something develops to the stage that they will need to have another treatment, and that is more painful, and it's not very, it's terrifying sometimes for the women.
Well,
and of course, mammography, that's also important to explain that mammography cannot detect fast-growing cancer in pre-invasive stage. So that's also where thermography is coming, that, the cancer is developing slowly, very, very slowly in the first stage, and that's why this tool is so important to use, thermography, because we can see something that self-exam or mammography will never see. So that's what is great about that.
Well, Bea, tell us how people can come and do the test through you, first of all, and maybe you can give us any information that you have possibly about where people can go if they're not in Spain, or if they don't have access to you. Where can we go, like someone like me who wants to do the test, other than bring you to Bahrain?
Of course, there is list of people. The thermography currently is growing worldwide, and it's available in US, in China, in Philippines, in Australia, New Zealand, Canada, Thailand, Germany, England, Holland. So it's growing slowly, but it's growing, and is growing fast. I believe that there is places, if you go on internet, if you put thermography exam, you will find places, maybe not in your area, but you can always come to Spain, and this is also mobile business, so I can always travel, and I am available wherever I want to be.
Well, I'm not aware of it being in this region. Maybe it is. It hasn't come to my attention, but maybe this show we'll get somebody to contact me who is offering that. But where can people go to get more information about you specifically?
People can get more information about me going to my website, that is Hermedicprevent, www.com. There I explained a little bit more about technology. I explained a little bit about mammogram and thermography.
What's the website again? Thermedic Prevent?
Thermedic Prevent.
Thermedicprevent.com. Okay.
Yes. That's
and that's how they can book an appointment with you as well to have the test done.
Yes, of course. Yes.
Okay.
They can book up. Yes.
Okay.
Not maybe from your region, of course, when they're coming.
Yeah.
That's a little bit old, but that's how people can book the appointment with me. Yes.
And you were mentioning at some point that it's that you can actually move and go to different countries and test people. How big is this machine?
The machine is the size of the camera, and it's not very big. There are different kind of machine, but they are not very big, and they are not stationary, and they are mobile, so they can move with me wherever I go. Okay. That's what is good. So I can go to countries where this is not developed yet, and I can help women to see how the breast, how is their breast health.
Well, that's fantastic. Bea, thank you so much. We learned so much from you today, and I hope that this maybe spurs on a few people to get the thermographic test done, and I'm certainly considering it now. It sounds very interesting, and I'm definitely up for anything preventive for sure. But thank you so much for coming.
Thank you very much for having me.
And thanks to the technology as well for allowing us to do this.
Yeah, that's true.
And to all our viewers and our listeners, thank you for watching the show today. To get more episodes, you can go to daretobehealthy.com. That's it from us. We're signing off. Thank you.